Aaron's got this story in the news about this Dr. O'Neill down in South Louisiana who seems to be sounding the emergency alarm for this Delta variant thing. Explain to us, is it as serious as this South Louisiana doctor is making it sound?
I don't want to panic people. I don't want to, like I've said before, I don't want to be a fearmonger, but this variant is by far the predominant strain that we're seeing in Louisiana. It's more contagious. It is making people sicker. And so we want to make sure that people get vaccinated, that people take care of themselves, protect themselves, and get tested if they don't feel well.
It seems to me that last year when people were getting sick and hospitalizations were incredibly high and the death toll was mounting, that you read about it every day. It's I'm not seeing the same media intensity as last summer. Is that because despite the severity of this variant that so many people have been vaccinated that it's just not as bad as far as hospitalizations and casualties go?
No, that's not true. Now, we aren't seeing the casualty rate rise as quickly, but that usually lags behind. We have, in the last 2 weeks, climbed from about 200 cases a day to now we're up to 1,500 cases a day in the state. And we've climbed from about 200 people hospitalized. Now, remember, we were down to about 30 a day hospitalized. We're up to 575, and that was on Friday. So I don't have the weekend's data yet, but we're climbing rapidly.
The 1,500 a day, Martha, how does that compare to what time frame last year? Where does it compare to?
You know, my team, we keep talking about how we feel like we're back in the summer last year, where we had slowed, we were doing better, and then we started to see this climb, and we had that surge at the beginning of the summer. So we feel like we're back there, except for this variant is so much more contagious, and I think people aren't getting tested. So I think the numbers are probably higher. The other issue that's concerning, and people need to understand, those 575 people in the hospital, those are people, it can be children. We do have children. I have a newborn born with COVID, which we haven't had but one time before in the state, in our hospital up here. And but those people hospitalized, they're 18 to 49. We are seeing some elderly people who have breakthrough cases. Most of our elderly did get vaccinated because they had concerns. We're seeing young, healthy people hospitalized.
Dr. O'Neill says because the virus has mutated so extensively, I'm quoting her, anyone infected by last year's version does not have immunity to the new Delta variant. Unless we're vaccinated? I'm hoping you will say that.
If you were exposed, depending on how well your body mounted a response to that, so how much antibodies you made, how much protection you gained from that exposure, it's going to help you somewhat. But this is a different strain, so it's not going to completely protect you from Delta variant. The vaccine has so far protected us from the Delta variant, so it is important to get vaccinated. The other issue with having COVID prior and thinking that that's going to protect you is some people get minimal to no protection from that because they had just a mild case. One of those nothing cases that they talk about. Mm-hmm. And also we know that those antibodies don't last maybe 4 to 9 months, depending on how severe your infection was and how much of a response you mounted to the virus.
So here's my question, and my feelings aren't going to be hurt if you say to me, Robert, this is way over your head. Let's move on. So here's my question.
Robert, sorry.
Can you explain to me in a way that I, with my 85 IQ, can grasp? What's the difference between the antibodies produced by my body because I had COVID and the antibodies produced by my body because I had the vaccine?
The easiest easy answer is the way they study the vaccine is they study how much they have to give you to create a strong response by a person's body. It is a much more known response. So I know when I give you this vaccine, this is the kind of response you're going to mount, and this is the protection you're going to get. And with an infection, people are mounting all different types of responses. We have people who have antibodies like David Langston, who had antibodies a year and a half out, was still giving blood. We have some people who a month later had no antibodies.
I know you're going to be happy about this. I understand that completely. So thank you very much. No, I really do, I think.
Doc, the governor has said, despite this new threat, he's not considering reinstating any previous COVID restrictions, including a mask mandate. Would you advise him differently?
Everybody wants to think we can make strong recommendations and people will follow them. Because of the work on the ground that I've done, because of being cussed out in the city council chamber, because of the response that I've gotten, I don't think recommendations are going to work. People are going to not do because they don't want to do. So in my opinion, the sooner we do mandates, at least to some degree, it doesn't have to be lockdown. We don't want to go back to that. Mm-hmm. Nobody wants to go back to that. But the way we're going to avoid that is wearing your mask if you're in large groups. So in stores, we need to be wearing our mask. In churches, we need to be wearing our mask. If we're going to have, and social distancing. If we're going to have weddings, we need to be wearing our mask and social distancing.